Hi, my name is Chris Manabe, and this is the weekend after President Biden's inauguration. I'm posting this video because we need single-payer Medicare for all now. During this pandemic, it has become very apparent the level of disparities in the current healthcare system. Those who have had access to healthcare most of their lives have better outcomes when infected with the COVID-19 virus. Single-payer Medicare for all would provide healthcare equitably and removes the current discriminatory tiered healthcare system designed to give the best health outcomes to those with the most wealth. I've worked in the visual effects industry for nearly 30 years. I've worked on some of the biggest blockbuster films and movies, and yet at times I struggle with healthcare for myself and my family. After the big recession of 2009, most of the visual effects industry moved to Canada to get incentives in the form of Canadian subsidies to the tune of $660 million per year. I was given an ultimatum to move to Vancouver to keep my current job or stay and try to find another job somewhere else. I chose to stay, and jobs became scarce. If you're not consistently working at a full-time job, healthcare insurance becomes a major pain to try to manage. Before the pandemic, President Biden's plan for the ACA would have still kept 20 million people from being able to get healthcare insurance. After the pandemic, who knows how many people will be out of work with no healthcare coverage. Healthcare insurance companies made over $30 billion in 2019. They spend millions of dollars to lobby Congress to allow them to continue to profit from this unjust and unfair healthcare system. The healthcare industry continues to spread lies and falsehoods about cost and health outcomes of single-payer Medicare for all because they are afraid of losing their giant cash cow. In the richest country in the world, in the richest state of the union, healthcare is a human right that must be made available for all its citizens. Gavin Newsom, Californians know the truth about healthcare. Begin the application process for the necessary state innovation waivers from Health and Human Services. Lobby state legislators to introduce a California single-payer Medicare for all bill, and publicly pledge within the first 100 days of the Biden administration that you will sign this legislation by 2022. California deserves to not have to worry about health care. Californians deserve to never get another medical bill. Californians deserve Medicare for all.